I probably say this in every video, but I hate teaching other people's material. I think it's cruel that Parca has crammed chest and abdomen anatomy into one section, section 2.2. Because this is so long and there's so much information on the slide, so I'm not going to go over all of the anatomy on each slide. I'm just going to do an overview from what I see on the slides. So here we go. This is an overview of the respiratory system. It starts at the nose and it goes all the way down to the lungs, and then the big muscle below your lungs called the diaphragm that makes you breathe. This is an overview of the digestive system. It starts at the mouth and goes all the way through the digestive tract. This is the heart. It's a big organ in your chest, and there's a lot of anatomy in here, so be sure to review this slide carefully. There is a few heart anatomy questions usually show up on the Parca clinical exam, section 2.2. This is a more detailed slide of all the anatomy in the lungs, and if you have questions about what each of these things or what the lungs do or how they work, feel free to send me an email. I'll be happy to go over any anatomy with you. This is the ribs and the sternum. So the sternum has a top part called the manubrium. This is the body, and this tip is the xiphoid process. And then you've got these different types of ribs. And pay particular attention to what the true ribs, the false ribs, and the floating ribs. That's another place where Parca loves to ask questions about true ribs and false ribs. This is the anatomy of the pharynx. Pay particular attention to the different branches or types of pharynx. That's another place where Parca likes to ask questions. This is the mediastinum, and this is a little difficult for people to understand. Students in the past have struggled with the mediastinum. So basically you've got this cavity that holds the right lung, and you've got this cavity that holds the left lung, and then in the middle, between them, of course, you have the heart, and it sits inside an area of space called the mediastinum. This is the mouth, all sorts of anatomy in your mouth. This is the esophagus and the stomach, or the upper digestive tract. These are the parts of the stomach, and just notice that the fundus, this is towards the head up here, the fundus is actually the tallest, highest, most part of your stomach closest to your head. So just notice that the fundus is on top. That's another question that Parca likes to ask. So this is anatomy of the small intestine. You might want to know the three parts of the small intestine here. That's another place Parca asks a lot of questions. This is the colon. You want to pay particular attention to the hepatic flexure and the splenic flexure. And notice the hepatic flexure is under the liver, and the splenic flexure is under where the spleen would be. So that's another point of emphasis for Parca. So I'm trying to pick out the parts where I know Parca asks a lot of questions. Like on this slide, they don't generally ask a lot of questions about the liver or the gallbladder. In fact, I've never seen a gallbladder question on the Parca exam, so I don't spend a lot of time on the gallbladder or really anything on this slide. There's just not a lot of questions coming off of this part of the anatomy. So these are the ducts, the different ducts coming off the liver, and how the gallbladder is organized. It has a fundus and a body and a neck, and you have these different ducts. But again, I don't think you need to spend much time on that. Not a lot of questions coming off that slide. More than a few questions coming off this slide. This is the kidneys, ureters, and bladders, and these glands sitting right up here that aren't labeled are the adrenal glands. The adrenal glands sit on top of the kidneys, so that's a good one to know. Parca likes to ask questions about the adrenal glands. And finally, the bladder, and this triangular area at the base of your bladder is called the trigone. So good things to know. That is a lot of information, and I know I only kind of went over it in a summary format, so study section 2.2 a lot of questions in there, and don't hesitate to email me if you need help. Thank you for watching.